Hi, welcome to the Lam Show. I'm Dr. Carrie, and I have Dr. Isabel Hunsinger with me. She is actually Cuban American born, but now currently in New Zealand, and they're experiencing this different culture. But she has been studying functional medicine, really trying to get to the root cause of disease and treatments. That's exactly what we like to do too. And her expertise is in Alzheimer's, dementia, cognitive decline, anxiousness, depression, and diabetes. She's currently doing telemedicine for the past 7 years and with our online business, doctoronamission.com, where they do online courses and coaching. And so we're going to be talking today about overcoming Alzheimer's, depression, brain health, and how it's also connected to diabetes. So welcome to our show.
Hi,
Isabel.
Carrie. Thank you for having me.
Yeah, it's very good to see you. So, I like to just ask people what their journey with integrative and functional medicine and how you came here because everyone has their story to tell.
Great question. I've been a medical doctor since 1991. Graduated from the University of Colorado in Denver, Colorado. Yay, Colorado.
Yes.
And in 2000, I was really unhappy practicing medicine in America with the HMOs and having to call and getting cleared by an 18-year-old if I can order a CAT scan of the head. And so I was like, one day in February of 2000, my husband and I were at home and I just told him how unhappy I was practicing medicine in America. And I'm a medical doctor trained in America. We can go anywhere to help the world, you know? So we had always skied with the Kiwis in Colorado. And so I said, let's check out New Zealand. So we moved to New Zealand in 2000. And it's so funny because, you know, what you run away from still stays right on your back if you don't figure out what the root problem is. And the root problem
Mm,
is that I needed to realize that we don't have a healthcare system. We've got disease management.
yes.
And even in New Zealand, that is the case. And so
Oh, really?
yes, very much so. We have got such a tremendous amount of chronic disease here. So in
Hmm.
2000, I got turned on to the Institute of Functional Medicine. The practice that I went into was a doctor that was into functional medicine.
Oh, great.
So he taught me about that and I got turned on and I've been studying it ever since. And then in 2013, I gave away private practice to just start Doctor on a Mission.
That's great. And it's so right. We don't do healthcare, right? In America, we do sick care. And yeah, people come with their sickness and their diseases, and we're just patching symptoms. And we practice functional medicine to get to the root cause and help you from the inside out. So that's really great. So how do you also get into, this brain health? Can you talk about how you came into helping people prevent and overcome Alzheimer's and depression?
Yes, absolutely. And it starts with a story, my story. And in 2013, like I had said, my husband and I agreed that it was time to start Doctor on a Mission. And so here I am, I've seen Dr. Mark Hyman and what he's doing, my fearless leader, my mentor in functional medicine. I'm like, I got to do that. I got to do that. So gave away private practice. And at 2013, I was 53 years old. So here I am, a wife, a mother, a doctor, and a brand new entrepreneur. Something that you and I did not learn in medical training, did we?
Definitely not.
No.
Definitely not.
But you know what? We could teach it, couldn't we?
And
So
nutrition, right? That's not something we got from medical school either.
yeah, and sleep and stress. And oh, so then after a year, I realized that I was just very anxious and joyless and hopeless. And when I get anxious, I don't sleep. And you and I both know how important sleep is. And, you and I are trained to survive on 2 or 3 hours of sleep in our medical training, which is disastrous. And so after every night for 17 nights, I only slept 2 to 3 hours every night, Carrie. And by the end
Wow.
of, yeah. So by the end of the 17 nights, I just tried to take my life. And I
Wow.
tried to do that twice in 3 days. And luckily, by the grace of God, that plan was interrupted by my
Mm.
daughter coming into the garage. And my husband took me to our pastor. And then the pastor and my husband agreed that I needed to go see the psychiatrist. And a
That's
medical
that's
doctor,
yes.
a
Mhm.
medical doctor having to see the psychiatrist is like a bad situation. So, but
Mhm.
at that point, I had totally surrendered and was very obedient. And so I went to the psychiatrist because the GP was like, this is way above me. I can't take care of this. You got to see the psychiatrist. And the psychiatrist put me on medication to help me sleep, which I'm so grateful because there is a place for conventional medicine. There is a place for
Yes.
pharmaceuticals, right?
Mhm. Mhm.
And then I remember the doctor saying, the psychiatrist saying, Isabel, you're going to be on these antidepressants for the rest of your life. And at that point, I was like, yeah, whatever you say, doc. But inside my soul, I was like, we'll see about that.
Yeah.
And then I went on a journey for 5 years. And during that journey, I learned how to pivot. And we spent a lot of money in this pivot and we made a lot of disastrous mistakes. But the key is I learned all the different cracks in a foundation that can affect our brain health. And it
Mm.
helped me understand that I shouldn't feel ashamed that I was suicidal. I should understand that my brain is an organ and we
Mhm.
just need to learn how to take care of it like any other organ in our bodies.
Yes,
That is
definitely.
not taught in medicine. So now I'm 7 years out. I'm off my antidepressants. And
Yay.
I'm not saying don't be on antidepressants. I'm just saying have hope that if you
Mhm.
repair your foundation, you
Mhm.
could come off your antidepressants. And now I'm peaceful and joyful, and I'm just making my mess into the message to help
Mm.
people overcome anxiety and depression.
Oh, I love that.
And on that journey, I learned how anxiety and depression and prediabetes and diabetes increases our risk for Alzheimer's.
Mhm. Mhm.
Scary, huh?
Yeah, they say it's a metabolic issue, right? For the brain that you can. Alzheimer's is diabetes type 3. Isn't that the saying?
Well, that's one of them. Because I've trained under Dr. Dale Bredesen. Are you familiar with Dr. Dale
Yeah,
Bredesen?
Bredesen
Yeah,
protocol.
yeah. So I'm a Recode 2.0 certificate practitioner. So he teaches us that there's 6 areas that can cause Alzheimer's. And that if
Mhm.
we just figure out the 6 areas, then help patch that up. And of course, prediabetes is one of them. That's Alzheimer's. He does it in types.
Mm.
So
Right,
yeah.
so that's great. So maybe we can get into it. What are the foundational things you'd like to start with in order to look at people when we're looking at brain health, just in general? What parts should we be looking at?
Um, Everybody needs to be sleeping good,
Mm-hmm.
7 to 9 hours of sleep. And I'll just go ahead and break it down the way Dr. Bredesen has taught us.
Mm-hmm.
Okay. And I'll keep it as simple as possible. Yeah. But the first,
Our
there's
listeners love
I,
that.
I know. I love simple. I'm
Yeah,
a simple-minded person. I don't know how I made it through medical training
yeah.
because
Mm-hmm.
I love simple. So there's 6 types of Alzheimer's areas that we need to look at when we bring on a patient. And the first type is, well, I just want to kind of backtrack and let people know that Alzheimer's and cognitive decline starts 20 years before we
Mm-hmm.
start expressing it. And the key is start taking care of your brain right now.
Mm-hmm.
That's number one. And
Earlier
a lot of,
better,
yeah,
right away. Yes.
yeah. And 2/3 of the population of Alzheimer's are women, unfortunately. So
Mm-hmm.
we have a lot of work to do in that area. And there's just a lot of hope, which is what I love,
Mm-hmm.
because I love to see that people can get better if they
Mm-hmm.
can just learn how to reverse it. So type 1 is inflammation. Why is your brain on fire?
Mm-hmm.
And it could be from a lot of things, like a leaky gut, poor gut health. It could be from pathogens like gum disease, P.
Right.
gingivalis.
Mm-hmm.
So that's really important. Mold toxins,
Mm-hmm. Heavy
environment,
metals.
heavy
Mm-hmm.
metals, environmental toxins.
Right.
Uh, and the,
Inflammation. Mm-hmm.
yeah, inflammation is number one. And then metabolic syndrome, which you know what that is. It's what we see in the world, not only in America, but in New Zealand and Australia, even down under, which is
Mm-hmm.
your large belly, people having a little bit of high blood pressure.
Mm-hmm.
Um,
Or
their,
high triglycerides. Yes, the
their
cholesterol is a little high. Mm-hmm.
Yeah, but cholesterol, look, Dr. Bredesen teaches us that cholesterol is so important. We need a good cholesterol because your brain is fat, but
Fat.
we look at the LDLs, the small dents, that heavy LDL, as you know. But
Mm-hmm.
I know I'm speaking to a doctor, but we're really speaking to the world, and not
Yeah, no,
everybody's
our
trained. So
audience needs it,
yeah, yeah.
definitely.
And then also the metabolic syndrome also consists of prediabetes, type 2 diabetes. So that's your inflammation. If you can see why your brain is on fire due to inflammation, repair it, and that'll help you tremendously.
Right, remove the triggers and repair the inflammation. Mm-hmm.
Exactly. Yeah.
Mm-hmm.
And then the next type is type 1.5. And 1.5 is called glycotoxic. That's just a fancy name for sugar toxicity. Glyco is sugar, as you know,
Mm-hmm.
Carrie.
Mm-hmm.
And
No.
I just have to imagine a million people behind you, and I'm speaking to them, and
Yes,
you're just in the
yes.
front. Okay.
Yeah, no, our listeners are loving this. So definitely make it simple and easy to remember and understand. And even I'm learning.
Yeah. And thank you. And Dr. Bredesen says that this is self-inflicted cognitive decline because it's so easily reversible. If we
Yeah.
just make sure that we get rid of the sugars, we eat good carbohydrates, good proteins, and good fats at each meal.
Mm. Good
And
carbs, meaning like vegetables, complex carbs, right? And
no, I'm talking about cookies and cakes and candy and
oh,
soda, all the stuff that we're taught to be
the
healthy on
glyco, yes,
TV, right?
yes, yes. The
No,
refined carbs are not the good ones, but the good carbs to eat are the complex carbs, the vegetables.
yes.
Hmm.
Yes. And your vegetables, I mean, even an onion has carbohydrates. Even a carrot has carbohydrates. So
Right,
yes,
you can
the
get it in
good,
there.
yeah, the good carbohydrates. I was joking about the candies and yeah. Hey, I got a joke for you.
Uh-huh.
It's a doctor joke. You want to hear a doctor joke?
All right, all right.
All right. So a 92-year-old man went to go see his doctor for his annual physical. And then a week later, the doctor sees him walking down the street with his lovely young wife. And so the doctor walks up to the 92-year-old man and he goes, "Well, looks like you are doing mighty fine." And the 92-year-old man says, "Doc, I'm just following your prescription. You said be cheerful and get a hot mama." The doctor said, "No, no, no. I didn't say be cheerful and get a hot mama. I said be careful. You got a heart murmur."
Oh, wow. That's great. Be cheerful and get a hot mama.
Yeah. And
I
how
gotta
many
tell that one.
patients? Yeah, yeah. Just remember, it's be cheerful, get a hot mama, and then the punchline is be careful, you got a heart murmur. If you remember those two things, it's
Yeah,
easy.
yeah.
So type 1.5 glycotoxic, if we can decrease our blood sugars, just like you had said, with a good carbohydrates, good protein, good fat, and fiber, because fiber stabilizes our blood sugar. And if we can just do that with every meal, then we can get like up to 4 hours of
Mm.
satiety. We'll be happy for 4 hours and we won't need to eat so much food.
Mm-hmm.
Yeah. And he also says that when you have type 2 diabetes or pre-diabetes, you have a twofold increase of getting Alzheimer's. So I'm all for getting us to reverse it as fast as
Prevent,
possible.
yes, prevent
Yeah,
and reverse type 2 diabetes. Hmm.
right. So that always scares people. Hey, when I tell them you got pre-diabetes, you're walking towards Alzheimer's. You happy about that? Are you aware about that? And they're like, no. And I go, okay, the work starts now. It's up to you, your choice. I'm just your coach.
Mm-hmm, mm-hmm.
Yeah.
You're right.
The type 2 is called atrophic. And atrophic is simply suboptimal nutrients, suboptimal hormones, and then suboptimal trophic factors. And I'll start with trophic factors. Trophic factors are proteins that allow the nerves to follow a certain path, like BDNF, brain-derived neurotrophic factor. And that just helps the neurons, the nerves to connect. And one of the fastest ways that we can increase BDNF is walking. So I always let people know your best healthcare is a pair of walking shoes and just go walking fast as if you're late for an appointment.
Yeah, yeah.
And then hormones, this is the big one for women, because what happens to us? Well, after menopause, we don't have hormones. A lot of us are afraid of being placed on hormone replacement therapy. And so our estrogen is so important for our brain. Testosterone is important for our brain. Progesterone is important for our brain. So we see that. And also in men, I'm not saying that men don't get Alzheimer's, but hormones are really important.
Mm-hmm.
And then your vitamin D levels, as you know, and everybody know that.
Hormone.
Yeah, vitamin D is a hormone, not a vitamin, it's a hormone. So now you know. And then your thyroid hormone is really important.
I like to say it's 3 legs of a stool, or it's actually adrenal hormone, reproductive hormones, and also the thyroid. All those hormones are so important to be stable, and they work with each other. So if you have one leg of the stool that's off, you're going to be falling down the chair, right?
That is a really good point. And just as you probably already know, cortisol, if your cortisol levels are elevated, that shrinks your hippocampus. And your hippocampus, I didn't say hippopotamus, I said hippocampus, everyone. And your hippocampus is like an elephant. It's your memory. It remembers everything. But if you're high stress level of cortisol, then it's going to start shrinking your hippocampus. And we don't want that. And then the suboptimal nutrients are like your vitamin Bs, your zinc, your vitamin C, and your CoQ10 and did I say zinc? Yes, zinc. So that is type 2. And then type 3 is your toxins. And oh my gosh, this is like a subspecialist, area, as you probably know. Toxins. We're so exposed to toxins.
Everywhere. Pesticides, the foods that we eat, right? And even the water that we drink or our environment, they're full of toxins. And so it's important to be able to do mini detoxes every day, right?
Yes. Like what kind of detoxes are you talking about?
Like simple, gentle ones like oil pulling, I recommend, where you swish around some oil in your mouth, and coconut oil, sesame oil, sunflower oil just helps to make your teeth whiter, but also pull some gentle toxins out. I do different challenges also, like distilled water, where that can also help to detox people, and drinking lemon water, helps your liver out. So any type of detoxing in a continual and gentle way will be very beneficial for the constant bombardment of toxins in our environment.
Great point, Carrie. I love that. And how about a little lymphatic drainage on the rebounder?
Yes. That's very good too.
I get on my rebounder. Moving. Yeah, I get things moving, because a lot of people don't know. And did you know that your lymphatics, which is your lymph node systems in your brain, drain best when you lay on your side when you're sleeping? So you're cleaning out your lymphatics while you're sleeping if you lay on your side.
So that's why you have to have good sleep, like you said.
So there's it's very common in women around menopause to see these toxins starting to show up. And that's essentially because we're losing the hormone support in our brain. And we've got years of exposure to toxins that are kept in our bones and our fat. And as we go through menopause and later on, our bones start breaking down. So the osteoclastic, which is just these little Pac-Men that eat our bones and cause osteoporosis, when those little Pac-Men start chewing up the bone, the toxins are released and our brain is like, whoa, I can't think anymore. So that's why we see so many toxins in women. And there's 3 categories, as you know. One is metals, and that's like your mercury, your lead, your cadmium, your arsenic. And then your organic chemicals like glyphosate, pesticides. There's this one test by Great Plains that I do that checks 172. Oh my gosh, 172 chemicals. I can't believe.
Right? Yeah.
It blows my mind when that comes back.
A lot of chemicals, and you don't even know. Babies also have them, right? The chemicals now.
I've never checked a baby. Babies have them too.
From their moms, yeah, even from the womb, and yeah, what the mom eats goes into breast milk. Goes to the baby.
Wow.
So we gotta clean out. We gotta clean ourselves out. Like you said, it's 20 years, right? It shows up, and so you have to work on it now if you want to prevent Alzheimer's later.
Absolutely, absolutely. And then other organic chemicals are like paint thinners. I used to love painting. And I would, yeah, but I don't do that anymore.
Water-based.
Yeah, water-based. And then our plastics, like your BPA, your BPB, your BPS, and BPF. And then the third category is your biotoxins. And biotoxins are just toxins produced by living organisms. And so we've got your molds. Oh my gosh, molds. Are molds big in California?
Yeah, mycotoxins. You wouldn't think because we don't have much rain, but still there's water leakages, that can happen. And so a lot of occupational buildings actually have mold in them. Even bathrooms. I mean, bathrooms are always a place where it's nice and humid, and so mold loves to be there. So I think it's very rampant.
Yes, so sad. And it's just, it's terrible.
Very inflammatory.
Very inflammatory. And then the herpes virus family. So HS1, if we've got cold sores, that increases your risk of getting into Alzheimer's in the toxic area. And then your oral pathogens like P. gingivalis. And then there's also Lyme's disease, which with all the co-infections. So those are all things that can cause dementia, cognitive decline, early Alzheimer's.
Wow.
Yes. Yeah. And then we go on to type 4. You still with me, everybody?
So inflammation, atrophy, toxins, right?
Yeah, inflammation, glycotoxic, atrophic with the hormones and the vitamins and stuff. And then the 4th one is toxins. And then the 5th one is, we've called it type 4 because type 1.5 is the glycotoxic. So the 5th one is called vascular, and that's just decreased brain flow to the brain because your brain needs blood. Now let's think of all the different ways that your brain is not getting blood flow. Having a heart attack. That's number 1.
Stroke.
Number 2, stroke. Not exercising is so important. Just 30 minutes of exercise a day pumps the blood into your brain. So you and I are both big advocates of huffing and puffing and getting. And so vascular is very key. Make sure you've got good blood flow to the brain. And also the last one, type 5, but it's also the 6th one, is traumatic head injury. Soccer players bouncing the ball on their head have a 300 to 500 increased risk of Alzheimer's.
Wow. Yeah. Concussions day in, day out. Yeah. You're shocking your brain.
Yeah. I'm so glad I never had a son, so that I didn't have to worry about my son wanting to play rugby, because rugby is huge down here. Have you ever seen rugby players?
Yeah, I don't know how they do it. They're just Oh, it is very scary to watch. I'm not used to watching it.
Yeah, well, I've learned to watch it here in New Zealand, and it's to go against that would be I'd be placed in jail. No, I
Mm.
wouldn't, but it's a big deal. But
Culturally, yes.
culturally, it's huge. So those are the areas that you have to look at to address. Okay, what's causing?
Right. And when we talk about Alzheimer's, it's not only Alzheimer's for brain health, but like you mentioned it before, it's anxiety, it's depression. For us, we call it our neural affect circuit, where, it's important to look at all these triggers that could be causing the root cause of the issues of the neurotransmitters and your brain health. And maybe it's also the gut, right? And so it's very important to have a big picture look at all your whole body in order to help your brain as an organ. So I thank you so much for going through all six parts, or five types, like you said,
Yeah.
five and a half types of
Oh,
the
I like
Bredesen
that five and a
protocol.
half type. That's good.
Yeah, I don't know why they make five and a half, right? It should be just six, but it is um, very useful to help break it down. And for someone who's struggling with kind of their neurotransmitters or their neural affect, um, to look at all six parts and see where they can improve. And so thanks. Yeah, thanks, Dr. Isabel. It's really great that you are able to go through this. If people wanted to get a hold of you or see where you're at, can you provide us with where they can find you?
So there's two areas that I invite people to, and one is the Bossy Brain Solution. It's our Facebook page. It's free, it's private, and it's only for women. Sorry, guys.
Mm.
And it's just to help you learn how to overcome anxiety and depression, how I did it and how they can too, so that they can think
Mm,
clearly and have lasting happiness because they don't
that's
have to
great.
be where they are.
Yeah.
So that's the Bossy Brain Solution. And then I'm also my website, Doctor on a Mission. That's doctor, DOCTOR on a mission.com.
That's great. That's great. All right. So thank you for coming on our show today. We've learned quite a bit about brain health. We invite you to like, to share, and to subscribe to our channel if you haven't yet. And we hope to see you next week in our next episode.